As the Agalactia Empire's agents continue to pursue Princess Ellen across the galaxy, the rebels have enlisted the help of Cephalosporins, a peaceful cephalopod humanoid species. In future sketches, cephalosporins will always be represented by a squid. However, don't let their good-natured and subtly cute squid-like appearance fool you. The cephalosporins are known across the galaxy as brilliant strategists and tacticians during times of war, and this sketch is going to take place in their galactic war room. Cephalosporins are the next class of beta-lactams on our tour. So once again, we'll sketch in our beta-lactam ringed planet in the distance, as well as our death caucus, under construction to represent the bactericidal mechanism of action of beta-lactams as they halt peptidoglycan synthesis in the cell wall. This is by binding PBPs, which were the construction workers from before. Cephalosporins can be classified into 5 major groups, or generations, represented here as cephalopod generals. As the tour progresses, notice that the cephalosporins are grouped by their spectrum of antimicrobial activity, starting with mostly gram-positive coverage in early generations, incorporating more gram-negative coverage and less gram-positive coverage with each generation, until the 4th generation, which has broad-spectrum antimicrobial activity. So keep this shifting spectrum of activity in mind as we sketch in the models sitting on the War Room strategy table. We'll see purple space station and ship models on the left, with the addition of more red gram-negative models to the table as we progress. Alright, let's meet our generals. The first general, General Lex, will represent the first generation cephalosporins such as cephalexin and cefazolin. He's flexing his arm to remind you of the name cephalexin, and he's wearing his home planet's formal headwear, a fez, to remind you of the name cefazolin, which sounds like cephazolin, maybe? Another way to distinguish first-generation cephalosporins is that they usually contain a pH in their name instead of the letter F. First-generation cephalosporins are very active against gram-positive cocci, such as staph and strep. And as you can see, the models in front of him are mostly purple gram-positive coccoid space stations. Oral drugs are used for staph and strep infections, such as cellulitis, soft tissue abscess, and a strep throat as a second-line agent. To show this, notice his puffy red cellulitis gloves and the red patches on his uniform, each patch an old streptococcal battle scar. He's also sporting a red bandana, which is our recurring sketchy symbol not only for the Rebel Alliance, but for strep throat, which is caused by strep pyogenes. First-generation cephalosporins cover a few gram-negative bugs as well, and that means they can be used to treat urinary tract infection. Proteus, E. coli, and Klebsiella are often sensitive, 3 important bugs that can cause UTI. Some students use the word peck to remember these species. Let's make General Lex giving a toast to his fellow cephalopod generals to a well-laid plan to overthrow the Empire. Notice the goblet he's holding, kinda representing a urethra and bladder with 2 ureter straws. Well, this is our recurring UTI symbol from Sketchy Micro, and here it represents activity against the gram-negative UTI bugs, Proteus, E. coli, and Klebsiella, as emphasized by the label on the glass. Also let the red color remind you of gram-negatives. One more thing. I had mentioned his old streptococcal battle scars. Well, those days are behind him. He's the only cephalopod with a doctorate degree on board this ship, as you can tell by his dignified fez. See the bloody surgical instruments on the wall behind him? These are here to remind you that cefazolin penetrates well into most tissues and is a drug of choice for surgical prophylaxis. Alright, let's move on to our second general, General Fox, here to represent our second-generation cephalosporins. He's pounding his fist on the table. It's a trap! He looks pretty furious, and this is to remind you of the name cefuroxime. Also, contrary to his hot-tempered nature, he's drinking a pleasant cup of tea for Cepho T10. It's a chai. It's quite pleasant. Also notice the name Fox on his uniform for cefoxitin. In general, second-generation cephalosporins are active against bugs covered by the first generation, but in addition they've extended gram-negative coverage. And so we'll sketch in some red gram-negative space station models into the battle plan in front of General Fox. Some students use hens to remember the extra gram-negative bugs, H-flu, Neisseria species, and Serratia. To show that, we have a teapot in front of him with gram-negative hens on it. Again, that's H-flu, Neisseria, and Serratia. We're not giving them their own symbols because second-generation cephalosporins are likely low yield on an exam, as they are not really used as first-line agents. So I'll only briefly mention some clinical uses. As oral agents, they're used to treat sinusitis, otitis, lower respiratory tract infections, highlighting their effectiveness against respiratory bugs such as strep pneumo, a gram-positive, H-flu moraxella, and Klebsiella, all gram-negative. They can also be used to treat mixed anaerobic infections such as peritonitis and diverticulitis, though on an exam, remember it's better to recall the other first-line agents against anaerobes, which we'll highlight in other videos. Alright, on to our third general, General Taz. It's obvious he's through with the deliberation and is ready to get out there and combat some serious infections. Compared with second-generation cephalosporins, third-generation cephalosporins have extended gram-negative coverage. We'll illustrate this by putting mostly red space stations in the battle plan in front of General Taz. These drugs penetrate tissues well, and when administered IV, some are able to cross the blood-brain barrier and achieve sufficient levels in the CSF, such as ceftriaxone and cefotaxime. Notice our third general is carrying his trusty axes, ready to axe some CNS bugs. This is our recurring symbol from Sketchy Micro for ceftriaxone and cefotaxime. You'll become well acquainted with third-generation cephalosporins because they are used to treat a wide variety of serious infections caused by resistant organisms. Let's go through them now. Our axes, ceftriaxone and cefotaxime, are used to treat meningitis. Remember this. On an exam question regarding a patient with suspected meningitis, ceftriaxone or cefotaxime is almost always the answer, because they are the first-line drugs for empiric treatment. This means that they cross the blood-brain barrier well to provide excellent coverage for the usual culprits, strep pneumo, H-flu, and Neisseria meningitidis, as well as a few other gram-negative enterics. Here's our recurring symbol for meningitis, the red mohawk meningitis helmet. And to emphasize H-flu, we've got company. It's our recurring H-flu biplane, and notice the H structure in its wings. A couple important things to remember about meningitis. First, vancomycin is often added for that extra gram-positive coverage of resistant strep pneumo. Second, for young and elderly patients, ampicillin may be added to cover listeria. For meningitis, let's work our way down, because third-generation cephalosporins are used for a variety of serious infections. This includes community-acquired and hospital-acquired pneumonia, which is why he's wearing that strep pneumo Knight's rusty chest plate. For hospital-acquired and especially ventilator-acquired pneumonia, it's important to consider coverage of Pseudomonas, and a select few of the third-generation cephalosporins are effective. That's where ceftazidime comes in. See the third general's name badge? Well, take a look on the wall behind General Taz, and you'll see a painting of the cephalopod queen looking ever so subtly like Mona Lisa, a recurring symbol for Pseudomonas. You have to admit, her enigmatic smile just as mysterious, even as a cephalopod. Remember that ceftaz covers Pseudomonas. But back to ceftriaxone, whose clinical uses go on and on. This includes endocarditis caused by strep viridans and those pesky Hassic organisms. To represent this activity, we'll incorporate the first major target of the war against the dark green side, the evil Emperor Viridans, with his creepy mitre hat. Remember, ceftriaxone goes everywhere. It even covers those gram-negative GI bugs, such as Salmonella and Shigella. Although this is low yield for tests because these infections are often self-limited and do not require treatment. Even so, we've made the bottom of his battlesuit look kind of intestine-y. Ceftriaxone is even used in the empiric treatment of sepsis. I just really want to convey that when you think of serious hospital infections, keep third-generation cephalosporins in mind. Though remember that they do not cover MRSA. I repeat, no MRSA coverage here. A couple other uses of ceftriaxone to note. First-line treatment of gonorrhea is a single dose of intramuscular ceftriaxone. And notice our recurring symbol of a drippy chandelier that evokes everything you'd wish you could unsee when you learned about gonorrhea-induced pelvic infections. Additionally, ceftriaxone is indicated in the treatment of Lyme disease, especially when it includes arthritis and neurologic disease. And yet again, Borrelia burgdorferi is represented by our bow and arrow wielding Robin of Exodes. Looks like Hans Sillen has failed once again to capture this elusive space outlaw. A cephalosporin ought to do the trick. Let's meet our fourth general, General Prime, representing the fourth generation cephalosporin, cefepime. All you need to know about her is that she is broad spectrum, penetrates CNS, and is active against Pseudomonas. She's one of your big guns for serious systemic infections in patients at risk for multi-drug resistant organisms. Remember that Pseudomonas coverage. Our Mona Lisa portrait in the back is associated with our third generation ceftazidime, as well as our fourth generation cefepime. Cefepime is highly active against gram-negatives, such as H. flu and Neisseria species, as well as gram-positives, such as staph and strep, and that's why we have her wearing the broad-spectrum prism pendant. Also note her broad range of coverage by the red and purple space stations in the battle plan in front of General Prime. Cefepime can be used for some serious infections, and it's able to reach adequate levels in the CSF. So to help you remember it can be used to treat meningitis, we'll incorporate our red Mohawk meningitis helmet. I want to reiterate, no MRSA coverage here, but that takes us to our last general, General Terra. She'll represent the fifth generation cephalosporin, ceftaroline. Ceftaroline also has a broad spectrum of action, hence the prism pendant, but mostly you need to remember her activity against MRSA. Recall from the nafcillin sketch that MRSA is resistant because of altered penicillin binding proteins. Well, ceftaroline can bind these PBPs. And here we have a figure of the dreaded Lord MRSA, the final and most dangerous target in the war against the Empire, who had previously wreaked havoc on our anti-staphylococcal penicillins. Well, checkmate. Alright, we're almost done with our tour, and just a few more facts about cephalosporins as a class. First of all, remember the adverse effects that were covered in our beta-lactam sketch. This includes interstitial nephritis, hemolytic anemia, and also that hypersensitivity reaction. Cross-reactivity with penicillin allergic patients is especially important. I also want to mention that cephalosporins, especially third and fourth generation, are stable to many beta-lactamases. So as we can see, those pesky beta-lactamase guards from our previous sketches are hovering over our later generation cephalosporins, but are unable to penetrate this stronghold. So an exam question may involve gaining resistance to cephalosporins by either altering PBPs or by producing extended spectrum beta-lactamases, which we'll see can be counteracted with carbapenems. Alright, let's say goodbye to our generals. First General Lex, who covers a few urinary bugs, but whose specialty is gram-positive skin infections and surgical prep. Second General Fox, who covers some gram-positives from the first generation, some gram-negatives from the third, and may be seen treating respiratory bugs. Third General Taz specializes in gram-negatives and penetrates the CSF, and really kinda penetrates everywhere to treat systemic infection. Those axes stand for ceftriaxone, and remember that drippy gonorrhea chandelier, and ceftaz for Pseudomonas. Our fourth General Prime, representing cefepime, penetrates the CSF and is your big gun antibiotic that also covers Pseudomonas. And finally, fifth General Terra for ceftaroline. You better watch your back, MRSA.